Hello, I'm Dr. Sumit Dewanjee, orthopedic surgeon practicing in the state of Arizona. I completed undergraduate training at Cornell University. After undergraduate, I returned to med school at University of Miami, which took an additional 4 years. I then completed my internship in SIU, Southern Illinois University, in orthopedic surgery and general surgery, which was 2 years, and then finished orthopedic training in the Phoenix Orthopedic Residency Program at St. Joseph's Hospital and Maricopa Medical Center, as well as the VA Medical Center, which was an additional 3 years. Finally, I was able to participate in a sports fellowship in Southern California with the San Diego Chargers, which lasted 1 year. The benefits of arthroscopic surgery is that it allows us to perform complicated procedures through small incisions. Thus, the incisions leave minimal scarring superficially. There's also a quicker recovery due to less trauma. Rotator cuff arthroscopic surgery is typically approximately 85 to 95% successful, depending on the size and retraction of the tear. They can also see full recovery in terms of range of motion and strength in anywhere from 6 to 12 months. As a sports surgeon, one of the other injuries we treat are anterior cruciate ligament tears. The ACL is most useful when a patient is running and then changes direction, which is known in sports as cutting. The other times that it's important is when a patient is performing a rotation type maneuver, such as pivoting and turning on the extremity. To treat this, we perform what's a surgery that's called an ACL reconstruction. Reconstruction means that the structure can't be repaired, but it has to be replaced. I've been doing ACL surgery for over 20 years. I found that there are certain things that result in a quicker patient recovery. Some of these are, of course, preoperative planning. The others are optimal selection of graft for the patient. We'll next be talking about meniscus repair or treatment of meniscal injuries. We've been doing this over 20 years, and we've become proficient at determining which types of meniscus tears will heal and which ones won't. The meniscus tear itself typically heals in about 6 weeks, and that allows one to return to sports as soon as their knee range of motion and strength is intact in approximately 6 to 12 weeks. I was born in Boston, Massachusetts. My father was a nuclear physicist and my mother is an entomologist and an artist. She recently published a cookbook. Interestingly enough, I went to the same high school as Jeff Bezos, who's doing quite well. He's probably our most famous alumni. I met my significant other while I was moonlighting as a personal trainer. We are now happily together for over 7 years. We also have a cat named Milo, who's quite cute. I enjoy my free time windsurfing, sailing, as well as hiking.